Hi there and welcome. I'm so appreciative of your connecting today to learn how to better understand your pet's progressive or terminal diagnosis and how that can help with decision making as you consider end of life choices along with your veterinarian. Now, this video short is just one of several that's planned in a series to help pet guardians be better prepared in working with their vet teams as their pet approaches end of life, no matter their age. Um, I'm going to start here by making just a quick introduction as to who I am and why I'm an authority in this area. My name is Lorrie Shaw. I'm a 20+ year veteran of the pet care industry, and I have spent the last decade of that time amplifying the field of animal hospice, which is my specialty. I'm founder of Telos Companion Animal Services, LLC, where my practice is focused on working with families here in Southeast Michigan, primarily the Ann Arbor area, as well as remotely with families across the US as they move through the serious or life limiting illness of their pet, as well as hospice, end of life, death care, aftercare, and grief support. I am a certified animal hospice practitioner, certified hospice and palliative care advocate, pet loss and grief companioning certified professional, and certified fear free professional. And so there are many factors that can shape how a pet's end of life is reached and how it unfolds. And so we're going to focus on just three here. But really, aside from a family's choice to opt for animal hospice support, natural death, or humane euthanasia care, both of which are overseen by a licensed veterinarian, of course, there are a few things that can shape how a pet does that. And so we're going to focus on how disease processes actually um, how as they unfold, how they affect the pet and how they can affect decision making. And so we're going to begin with that category of like chronic or progressive diagnosis. And things that come to mind for me most readily are chronic kidney disease or chronic renal disease. A lot of families refer to this when they hear the diagnosis from their vet that they're in kidney failure. And the truth is that most families discover that this is the case early on. There are four stages to chronic kidney disease, and they're usually finding it quite early. And the cat can live, or the dog. Dogs also can develop this. They can live for a number of years under good management. And so, again, it can lead to kidney failure, but in the beginning stages, it's not kidney failure. I just want to be clear about that. Another diagnosis that falls in this category is geriatric onset laryngeal paralysis with polyneuropathy and osteoarthritis, which is also progressive. We think of life limiting diagnosis or terminal diagnosis at any age, things like cancer. And we're going to talk more specifically about cancers in just a minute. But I really use cancer as an umbrella term because there's so many different types and how they affect the pet and their longevity. And so, of course, age related decline is usually a source of discussion for end of life care. And so many of the issues that are seen with the progressive diagnoses are in this category. And I want to say that in many cases, it's not just one category that's impacting the pet, all three can be present. And these terms can feel a little nebulous when you consider that they can all contribute. But what they all have in common is that they have inherent trajectories. And those influence how a pet moves through this time. And as is often the case, one diagnosis can prevail and pull forward, and it's important to understand its trajectory, though the others need to be factored in as well. And so, this is where the meat and potatoes of this talk is going to reside. And so, of course, there are some overlap with two or more trajectories most often, and that can depend on the pet's other diagnoses and, of course, their age and ability to cope. And so, after learning a little bit about these trajectories, my hope is that it demystifies perhaps what you might have experienced in the past with the pet, and it can help you better understand what to expect if you've had the unfortunate um, situation of a pet being recently diagnosed with a progressive or life limiting diagnosis. I find that having this knowledge really enables families to move through decision making with not only how they approach perhaps treatment options if they opt for that, but comfort care plans, and also applying that to how they approach end of life choices for their pet. And that can be done without sacrificing the care or the attention that they put into helping their pet be at their best over their lifetime. And I want to say, as an aside, that if you have any familiarity with the stages and types of animal hospice support natural death experience and how that unfolds, these trajectories that we're going to talk about are completely separate from those. So, just a word on that. And I also want to say that in understanding these trajectories, um, it really does help pet guardians get the most out of quality of well-being and quality of life assessment tools. And we're going to discuss all four of these here. So the first one is where a pet experiences an acute or profound insult to their neurological or circulatory system. Things that come to mind for me would be like saddle thrombus, sometimes referred to as fate in cats. And this type of trajectory tends to come on suddenly. A lot of families say that they feel terrible because they had no idea their pet was sick. And the reason for that is that it happens like that. And there's nothing that you can do to have stopped it. What happens is that the diagnosis comes on suddenly, and due to that level of impairment, in many cases, the families often find that that exceptional and really intense level of supportive and nursing care required to help the pet maintain activities of daily living and good quality of well-being in their routine, they just find it to be prohibitive. And so outcomes are often really poor, unfortunately, with humane euthanasia being opted for. The second trajectory encompasses assessments that involve a progressive decline with a prevailing condition, usually over a period of months or usually years. And these are, as you might expect, associated with the pet's geriatric years. And so the first thing that comes to mind for me is osteoarthritis. Again, that's a progressive diagnosis. Things like degenerative myelopathy, geriatric onset laryngeal paralysis and polyneuropathy. Cognitive dysfunction is another one that's progressive. And as needs increase, so does that nursing care that's required and the physical assistance and environmental management. And so pets that experience this trajectory commonly develop additional complications. And so some of these obviously have the feature of declining mobility as a feature. And so that factors in significantly. And so the third trajectory really involves chronic illnesses. And it's usually after years of treatment or management. Pets in this group experience that periods of decline, and then they'll improve or feel better. They have better symptom management, and their ability to cope gets better. They might even plateau out for a while. And so this level of care does increase over time with those symptoms worsening and the pet being less robust. And then that pet steep decline usually occurs, causing that pet to decompensate pretty quickly, eventually leading to death by way of animal hospice support, natural death, or humane euthanasia care. And the diagnoses that come to mind most easily for me are, again, chronic kidney disease that has reached end stage. Remember, there are four stages to this diagnosis. Things like congestive heart failure that affects the heart, of course. Liver diseases are most commonly associated with this trajectory. And so, as we look at the fourth, um, diagnosis like cancer is one that I think comes to mind for most people. And I want to say again, cancer is an umbrella term for me. Cancer can range from anything from primary lung masses, which are very slow growing, things like lymphoma, soft tissue sarcomas, anal sac tumors, blood cancers, brain tumors. Some of these can be treated, and many families do opt for treatment, which can involve chemotherapy and surgery. Um, and sometimes not. It just depends on the family's resources. It depends on the pet's telos or what really makes them who they are, how well they can cope. But then we think about things like hemangiosarcoma, bone cancer, bone marrow cancer. Um, those are typically very aggressive, and they all these cancers present very differently in how they affect the pet. And so you can see how that can make the decision making really complicated. And of course, the word cancer is always scary to families. And other diagnoses that fall under this trajectory are things like infectious processes, acute organ failure. Something that comes to mind for me is like renal injury, or say a liver injury that has maybe been caused by a toxin that they've gotten into. And so a timeline in this category would typically be like months to weeks, maybe days. And typical scenarios feature the diagnosis being discovered. In some cases, supportive and palliative care handles that pet's comfort and well being really well in those earlier stages until a predictable decline is seen in the later stages with that progression. And then a short period of steep decline prior to death, usually via humane euthanasia care. And so, after reviewing this breakdown, my hope is that it's easier to see how the changes that take place, how they affect the pet, and why it can look different for each pet. Um, for me, it also illustrates why planning ahead and implementing an end of life care plan that is aligned with the family's wishes, values, and beliefs is so necessary. That's because it helps relieve that pressure. And you don't want to be making decisions when you're under pressure like that, whether or not you opt for animal hospice support, natural death, or humane euthanasia care. And planning ahead after understanding all of this can really help a pet's end of life to be better managed should a situation arise where a plan B needs to be put in place, where you need to pivot and figure out what next steps are. And then again, that can reduce the stress on the family. And so while a pet guardian is conveying their wishes, beliefs, and values, and any limitations that they might have, whether that be with financial resources, resources of time, the ability to caregive, maybe their pet is not a good candidate for being handled a lot or accepting medications. Or maybe they've got so many other assessments that they're trying to cope with that it just makes it too difficult. Um, and so those can all be conveyed more easily to the vet team when you understand this, and you can feel a lot better about the decisions that you need to make. And that covers this quick primer for this short presentation. That is just one that's planned for pet guardians in an effort to be educated about what your options are. And there's more on the website, of course. There are resources, handouts, articles, and the opportunity to connect and work with me directly for ongoing support locally or virtually, no matter where you live in the US. And that can be done with an integrated support plan. I do welcome your contact via email. That email address is telos.cares@gmail.com. Again, you can go to lorrieshaw.com for all of those handouts and information. And I hope that you found all of this helpful, and I wish you the very best.